okay, I would think that a lot of the laymen would think that snoring is normal. Everybody is snoring, the whole family snores, okay? But the important thing is that you have to look for symptoms more than snoring. So if you think that they are actually gasping for breath, choking at night, you have to move them at night to make sure that they are really breathing. That is one sign that you are not only snoring, you may have sleep apnea, you're actually choking and not having enough oxygenation to your body. In the day, the patient itself, okay, can present with very, very bad headaches and being very, very sleepy. Okay, so this you need to see a doctor because you're not only snoring, you may have other problems such as sleep apnea, which you need to see an ENT to get the sleep test done, to get the diagnosis and determine the severity and the management. Tinnitus can be anything from the, if you look at the ear compartments, it can be the outer ear, the middle ear, the inner ear. Okay, so again, what can cause it? Many causes, from nerve degeneration from an elderly patient. So you need to look at the age of the patient again. If you're talking about children, very rare that patients will actually tell you in a child that the child is complaining of a noise, okay? So commonly we're talking about perhaps young adults, or the more elderly patients, okay? So anything in the ear, outer ear, we can think of ear infections, wax, discharge, or even a tympanic membrane perforation. Your eardrum may be broken. Your middle ear may have problems, be it water or infection, okay? The more elderly patients, okay, can have hearing loss associated with tinnitus, okay? We normally would take a history first, looking for the associated ear symptoms. Is there pain, discharge, infection the year before? Is the eardrum intact? We do a clinical examination through a ear otoscopy. And commonly, we would also do a audiogram. We would actually do a hearing test to make sure that the inner ear function is fine, to then conclude that it is tinnitus from infection, from nerve degeneration, and nothing too serious, okay? Okay, the history itself, I need to examine it a little bit more. Okay, allergic rhinitis should not only have the onset at 54 years old. A patient commonly presents earlier, okay, in the young teenagerhood with sensitive nose. Okay, so we need to get the diagnosis right first. And I normally would ask that, is there any associated asthma? Is there itchy nose, runny nose? Okay. If yeah, so commonly, okay, if it comes to see me, I would like to examine the patient with a flexible nasal endoscopy. Okay, because allergic rhinitis, commonly both sides of the nose is blocked. Okay, if the patient is compliant, the next thing I would like to ask the patient: you have all the medications. Have you used it correctly and every day? Okay, because lethal steroidal sprays do not improve nasal symptoms if you use it as and when you want. It doesn't work. Okay, so commonly I would say if you are a good patient, you have used your nasal spray in the right direction, right nose, right corner of the eye every day for at least 3 to 4 weeks, and your nose is still blocked, it is time for me to assess you to see if the rest of the nose is clear before I decide to do any nasal procedures.
Jangan lupa like dan subscribe.